Good evening, everyone. A very warm welcome to all for this IIHP Delhi State Branch webinar. Dr. Sujata Chaudhary, she's Research Officer, Homeopathy in Drug Proving Unit, Bhubaneswar, under Central Council of Research in Homeopathy, under Ministry of Ayush, Government of India. She has extensive experience in clinical trials, public health interventions, and evidence based practice. She has immensely contributed to national health campaigns and capacity building programs for Ayush. She has handled various projects under CCRH collaborative projects with RMRC ICMR Bhubaneswar and Bhabha Atomic Research Center Mumbai, a very eminent speaker, having attended various seminars and workshops across all over India and many publications under her kitty as well. She has taken out her valuable time for IHP Delhi State Branch today to enlighten us on the role of homeopathy in musculoskeletal disorders. Please, a very warm welcome to Dr. Sujata Chaudhary. Over to you, ma'am. Namaste, ma'am.
Thank you, Dr. Minalini, for a nice introduction and a warm welcome in this evening. Uh, a good evening to all and respected members, dignitaries, faculty members, practitioners, and dear colleagues. It's my privilege to be part of this academic gathering under IIHP platform. I sincerely thank the organizers for providing the opportunity to deliberate on a subject which is very clinically significant. So, to start with the musculoskeletal disorders, the musculoskeletal, I will share my screen. See, is it visible?
Yes, ma'am.
Okay, thank you. So musculoskeletal disorders,
Yes.
these comprise a diverse condition of affecting bones, joints, muscles, and connective tissues. These disorders may result in pain and loss of function mainly and are among the most disabling conditions. So WHO key facts about MSD, approximately 1.71 billion people have musculoskeletal conditions worldwide. Musculoskeletal conditions are the leading contributor to disability worldwide, with low back pain being the single leading cause of disability in 160 countries. Musculoskeletal conditions significantly limit mobility, leading to a early retirement from work, lower levels of well-being, and reduced ability of social participation. Because of the population growth and aging, the number of people living with musculoskeletal conditions and associated functional limitations is rapidly increasing. So these are the WHO observations and key facts about musculoskeletal disorders. So, as its name suggests, it constitutes muscular system and skeletal system, and the main components of MSD are bones, ligaments, cartilages, muscles, and tendons. So, musculoskeletal system forms the mainly structural framework of the human body and is essential for movement, stability, and protection of vital organs. And bones, joints, these are the components which together these components work in a coordinated manner to maintain posture, enable location, and allow the individuals or the persons to perform daily activities efficiently. So this system functions in not solely but in close coordination with the nervous system as well as the circulatory system, ensuring efficient locomotion, maintenance of posture, and mechanical protection of the internal organs. So the disorders of musculoskeletal system which affect mobility, function, and quality of life, and it is a major global cause of disability and chronic pain. So how it affects mobility, function, and quality of life? These disorders commonly lead to pain, stiffness, swelling, and restricted range of motion, which directly impair the individual's ability to move freely. As mobility becomes limited, routine activities may become very difficult. In chronic conditions, persistent pain can also affect sleep, emotional well being, and social participation. But beyond the physical limitations, persistent musculoskeletal pain is frequently associated with psychological consequences such as anxiety, depression, and reduced emotional well being. So, consequently, these disorders exert a profound impact on an individual's health related quality of life and overall functional independency of the individual as well. So, as a major global cause of disability and chronic pain, These represent one of the leading causes of disability worldwide and constitute a major public health challenge. So conditions such as osteoarthritis, rheumatoid arthritis, low back pain, spondylosis, all these significantly, these are the years lived with disability in a individual's lifespan. And according to WHO, whatever already said, that 1.7 billion, 7 million people are affected by musculoskeletal disorders in their lifetime and worldwide. So the burden of MSD is increasing due to the factor population, increase in population and their aging, sedentary lifestyles, occupational strain, obesity, physical inactivity. So these are contributing factors for the musculoskeletal disorders. And so common musculoskeletal disorders are osteoarthritis, rheumatoid arthritis, low back pain, cervical spondylosis, gout, fibromyalgia, tendinitis, and bursitis, and sarcopenia. So we all know these clinical conditions, and we are getting these clinical conditions in our day-to-day life practices, clinical practices, and we are effectively treating also through homeopathically. So the most physical pain, the most attributable thing is the physical pain in musculoskeletal disorder. So these disorders are most common causes of chronic pain, and the pain accounts for much of the burden of this skeletal condition. So because pain and impaired function are the predominant features of the most MSDs, so treatment studies typically assess the patient reported outcomes or measures in treatment outcomes. So although pain outcomes and functional outcomes are often correlated, but it cannot be assumed that improvement in pain will automatically lead to improvement in function or vice versa. So we cannot predict or you cannot assume that the improvement in pain and the improvement of the as well as the pain, they will be correlated. So International Association for Study of Pain adopted by WHO for International Classification of Disease, that is ICD-11 version. Chronic musculoskeletal pain is described as persistent or recurrent pain experienced in musculoskeletal structure, such as muscles, bones, joints, and tendons. And this classification distinguishes between the chronic two types of pain. One is chronic pain that cannot be attributed directly to a known disease or damage process. So this is called chronic primary musculoskeletal pain. These conditions cannot be attributed or directly related to any particular disease process. And in case of the second variety is chronic pain that arises from an underlying chronic disease. That is called chronic secondary musculoskeletal pain. So, for example, chronic low back pain is an example of chronic primary musculoskeletal pain, and whereas the osteoarthritis pain or joint pain associated with inflammatory diseases, that is rheumatoid arthritis, psoriatic arthritis, these are the inflammatory diseases of MSD, and these are the secondary musculoskeletal pain conditions. So the treatment approach in musculoskeletal disorder in conventional system, it includes a general treatment approach. Under their general treatment approach is a type of disorder. It depends on type of disorder, whether it is degenerative, inflammatory, or traumatic, severity and stage of the disease, and patient factor, that is age and comorbidity also influences the treatment process. The approach is usually symptomatic relief, control of inflammation, improvement of function, prevention of progression. So these are the general treatment approach in conventional system. In pharmacological treatment, the analgesics, NSAIDs, corticosteroids, disease-modifying anti-rheumatic drugs, biologic agents like anti-tumor necrosis factor agents, muscle relaxants, these are the pharmacological treatment for MSDs. And in non-pharmacological treatment process, physiotherapy, exercise therapy, lifestyle modification, heat and cold therapy, these are the main mode of treatment in non-pharmacological approach. On interventional procedures, intra-articular injections, nerve blocks, these are the interventional procedures in conventional treatment. In intervention, intra-articular injections of steroids, they provide temporary relief. And nerve blocks also, they used in severe pain conditions. And in case of severe advanced and tertiary stage, surgical management is required, like joint replacement, arthroscopy, and spinal surgery. And so from these procedures, some limitations of the conventional medicine treatment is there. It gives mainly short symptomatic relief. Long-term use produces side effects, and the biological agents like DMRDS and anti-tumor necrosis factors, these biological treatment agents, they are very expensive, and it is very difficult to afford for a middle or low socioeconomic population. And the surgery in this case, and in severe or tertiary stage, the surgical management also, this makes the risk for the individual. So in homeopathic approach, in musculoskeletal disorder, the management aims to reduce pain, inflammation, and functional limitation while promoting the body's inherent self-regulatory mechanisms. So in 2 stages, the treatment can be given in acute stages of this musculoskeletal disorder from like recent traumatic origins, medicine prescribed on basis of present complaint or present totality manifested symptoms. With acute totality, the medicine can help in these conditions in acute stages. But in chronic stages, the homeopathic approach is something different. We have to depend on the stage of the disease, and according to these stages, the treatment process in homeopathy is grouped into latent stage, primary stage, secondary stage, and tertiary stage. See, these are the differentiation, how to differentiate in latent stage, primary stage, secondary stage, and tertiary stage of the disorders. So in case of latent stage, the musculoskeletal stage of this MSDs, it refers to early subclinical phase of the disease process where pathological changes have already begun, but clear symptoms are absent or very mild and often unnoticed. So in subclinical pathology, early tissue changes may be there with micro inflammation, cartilage wear, muscle fatigue, but no obvious clinical sign will be there, which can be detectable in routine examinations. And there will be minimal and occasional symptoms, mild discomfort, stiffness, and transient pain after exertion, which will be immediate relieved by rest, and some fatigues in muscles or joints. Symptoms are often ignored in latent stage of this disease. And this disease also, this phase is mostly a reversible phase, and early intervention can prevent the disease process. And there will be trigger sensitivity, some prolonged sitting or standing, some physical exertion, severe physical exertion. These are the some repetitive strain, cold weather, physical exertion. They may trigger the complaint. And but there will be no structural deformity on MRI or X-ray. Or this may very early subtle changes will be there in case of MRI. In X-ray we can't find, or we cannot recognize, but in MRI there will be very early or subtle changes which often goes unnoticed. So, for example, in latent stage in osteoarthritis, early cartilage degeneration, but without joint space narrowing, and in low back pain also, occasional stiffness before chronic pain develops. So, importance of this latent stage, what is that? Subtle symptoms help in individualization. From homeopathic perspective point of view, the symptoms help in individualization. Early treatment may prevent the disease progression, and constitutional remedies can restore the balance. So from homeopathic point of view, The latent stage, it corresponds to early functional disturbance before structural pathology and expression of underlying miasmatic imbalance. And it is the stage where vital force deviation is mild but detectable through symptoms. If carefully the case is taken, then we can constitute the totality of the symptom, including their family history or any past history or any anti-miasmatic or constitutional medicine we can select by a careful case taking process. And the conservative treatment in this stage, the control of modifiable factors like predisposing or precipitating any causes may be modified accordingly to the symptoms of the mild symptoms of the disease. Then in primary stage, there is no functional limitation in this latent stage, and the reversibility is high. The chance of reversibility is very high. So in case of primary stage, the symptoms are very clear early clinical stages where this disease is beyond the silent phase, silent phase or latent phase, and there will be clear noticeable symptom begin to appear. Though structural damage is still minimal, though structural damage is still minimal or mild. The primary stage in which these initial pathological changes become clinically evident and the patients starts experiencing definite or mild to moderate symptoms. The condition is still early and largely reversible with proper management. It can be reversible, but there will be functional slight limitation of the functional activities. And the onset of the clear symptoms, pain, stiffness, restricted movements, muscle fatigue, and these symptoms are consistent for the patient to notice and report at the physician. And there will be functional disturbances, and the routine activities may be there will be difficulty in routine activities and a reduced flexibility of the limbs. And there will be mild inflammation or the signs of inflammation. Early inflammatory changes may be present, and minimal structural changes may be present there. In case of they may be identified or diagnosed through X-ray or MRI. And for this stage, the treatment process is the therapeutic treatment through constitutional medicine. And in this stage, prevention may be given through this constitutional medicine and the treatment of the avoidance of the modifying factors. And this stage is the best stage for the intervention. And there will be in this stage the disease may be well controlled, and the reversibility will be, in this case also the reversibility will be high with careful case taking and careful treatment of the disorder. And from the homeopathy point of view, already the clear expression, it gives the clear picture, symptom totality, and it is the ideal stage for individualization's remedy selection, miasmatic assessment, and preventing the deeper pathology of the disease progression. And in case of secondary stage, there is the persistent symptom development and established progressive stage of the disease, where symptoms become more persistent, more prominent, structural changes begin to develop, functional limitations increased, and the disorders progressed beyond the early primary stage, pathological changes more pronounced, and there is marked stiffness, reduced joint mobility, muscle weakness. There is established inflammatory processes, and some conditions also there will be inflammation may be effective, active and progressive. Structural changes begins functional limitations. There is difficulty in daily activities, reduced work capacity, and reduced quality of life. And the period of exacerbation and remissions are observed in this case. And the clinical importance of the second stage is the disease no longer fully reversible. There is partial reversibility in case of early treatment, and the risk of progression into deformity, disability, and chronic pain syndrome. And this requires long-term management. From homeopathy perspective, it presents the full-blown clinical presentation and supported by increased clinical parameters through laboratory investigations, progressive and irreversible pathological changes, and it is the assessment can be done by through any interventional or invasive process in X-rays and MRIs, and the disease-specific laboratory investigations. In this stage, the symptoms are well developed, and both functional and structural pathologies are present. In this case, therapeutic aim is to halt the progression of the disease and the elevate of the symptoms, and to protect the or the in this, because in this case there is prolongation of advanced pathology, so symptoms overshadows the constitutional symptoms and then difficult to get the totality of the symptoms. So fast symptomatology, uh, symptomatic, which usually leads to get a true totality, and then prescribe the totality, and intercurrent antimiasmatic treatment requires in this secondary stage. And in case of tertiary stage, there is severe severity of the symptoms, and it is the disability is severe, and there is severity in case of presentations or in all phenomena of the disease, all dimensions of the disease. In pathology also there is advanced pathology, and the diagnosis is possible through X-ray or in clinical examinations also. Intervention in this case is there is reversibility. This in this stage there is irreversible because of advanced pathology. And joint deformities we can observe, and severe cartilage loss, bone erosion, contractures of the muscles and ligaments, loss of muscle tone, uh, and difficulty in able to perform their daily activities, reducing highly or affecting highly the quality of life. And more evident, the inflammatory signs are there. So in this case, the pathological symptoms obscure the real or individualistic symptoms of the patient. So in this case, we should focus from management to from cure to management and rehabilitation, pain control, improving quality of life with multidisciplinary care and with supportive care and long term. This stage requires long term therapy. So this disease reflects a deep-seated miasmatic involvement. Structural damage is irreversible, but homeopathy can alleviate pain, improve mobility, or enhance general well-being, and slow the further progression of the disease process. And most of the individuals come in this stage with complications also. So there is irreversibilities. For example, stage 4 of osteoarthritis, end-stage disease, ankylosing spondylitis, and severity of the rheumatoid arthritis with the deformities of the bony deformities. So in this case, interventional plan is the symptomatic and palliative drug based on the keynote of the presenting symptoms. And we can select the medicines according to the presenting or characteristic symptoms of the individual. And next, constitutional medicine is the ultimate goal of the prescribing totality. So, according to or along with the keynote prescribing, this requires constitutional treatment, and in in intermediately or during the process, anti-miasmatic process or in also anti-miasmatic treatment also it requires. And symptomatic marked peculiar symptoms, we have to select the medicine basing upon the marked peculiar symptoms first, then the totality of the symptoms formed before the disease, what is the general or generalities, mental, psychosocial picture of the individual. So by taking all these things, we can construct the real picture of the individual in order to prescribe the constitutional medicine. So, so to differentiate in homeopathy and conventional management, treatment approach in case of homeopathy is individual treatment based on totality. patient, totality of the symptom and patient constitution, as these addresses physical, mental, and emotional aspects. Generally, this considered safe and with minimal adverse event due to ultra-diluted medicines, whereas in conventional medicines, long-term use of analgesics and NSAIDs may lead to other system adverse events, adverse effects on the other systems. And disease management, in case of disease management, homeopathy aims to stimulate the body's self-regulatory mechanism and restore balance. And in case of conventional management, often it provides the symptomatic relief through pharmacological suppression of inflammation and pain or pain. So in chronic disease care, in homeopathy, it frequently used in long-term chronic conditions with individualized follow-up and with minimal side effects or no or minimal side effects. Often, and in case of conventional medicine, long-term pharmacotherapy, it may be necessary and associated with cumulative side effects and more drug interactions. The patient-centered care is emphasized in case of homeopathy with a detailed case taking and individualized prescriptions. And in conventional management, consultation often focuses primarily on clinical science, investigation reports, and diagnosis criteria. And in case of homeopathy, generally low cost medicines and minimal investigations. But whereas here, in case of conventional treatment, the treatment process involves higher cost due to long term medications and higher cost of the medications. And integration potential in homeopathy, the integration with physiotherapy, lifestyle modification, and supportive therapies are possible, through which we can create a integrated approach in case of musculoskeletal disorders. And in conventional also, it can be combined with physiotherapy, rehabilitation, and surgical interventions when required. So the research and evidence in case of musculoskeletal disorders. In Indian Journal of Research in Homeopathy, one of the studies on rheumatoid arthritis, it shows it is an open label placebo controlled pilot study was there. The comparison between the homeopathic drugs, which results the possible immunomodulatory role of homeopathic drugs in rheumatoid arthritis. Rheumatoid arthritis is a immunological disorder, or the immunological responses are there in case of rheumatoid arthritis. So this study it confirms the observations of this study suggested a possible immunomodulatory role of homeopathic drugs in case of rheumatoid arthritis treatment. And another study, in case of knee arthritis, the homeopathic approach increases the activity or the quality of life of the patient. It was an prospective observational study. In this study, the homeopathic medicines have a potential to improve the activity of daily living of knee osteoarthritis patients by reducing pain and stiffness and limiting progress of the disease without any adverse systemic effects, and can safely be employed as a comprehensive healthcare therapeutics. And in other journals, in conventional journals also, so many studies have been published. One of the study result in electrical name stimulus, some herbals are found to be effective. Evidence exists to support superiority of homeopathic over placebo. And another study with the objective to assess the effect of physician practicing preference in primary care of homeopathy, complementary and alternative medicine, and conventional medicines on MSD patients with reference to the clinical progression. So in this study, the MSD patients seen by homeopathic physicians showed a similar clinical progression in comparison to other complementary and alternative medicine practices with lower NSAIDs related adverse events. Likewise, another study, 6 electronic databases were searched with data extracting and methodological study were done by an independent reviewer to critically evaluate effect of homeopathic on fibromyalgia in RCTs and placebo control studies. The results suggest homeopathy was better than placebo in alleviating pain. Like in another study also, the comparison between two groups with orthodox first-line conventional medicine. In one group, conventional medicine and homeopathic medicine are given, and another group, conventional medicine plus placebo. So, in case in which group in significant improvement in subjective pain, in case of individualized medicine, homeopathic medicine is given along with the conventional medicine, that group shows better result. Excuse me, madam. 1 minute, I am.
Sure, ma'am. Sure, ma'am.
Basis of discussing the possible benefits of homeopathy for fibromyalgia, and there is no significant difference in results in case of conventional medicine. There will be no significant difference results could be found in results. No side effect of homeopathy group, and there is no significant difference in results in two groups, which are in the comparator group. In this study, also in another study among IU systems, every IU system were included in this study, and it was seen that the out of 113 studies, 13% reported to have adverse events. And a comparative study in another comparative study also on osteoarthritis, allopathic, homeopathic, and herbal system was conducted. And this also, there is no adverse events in case of homeopathic group. And in allopathic group also, no significant difference in complaints, and also complications were difference in complications and complaints. And homeopathic and herbal medicine groups, there will be significant difference observed in case of complaints. So to conclude this, musculoskeletal disorders represent a major global health burden, contributing significantly to chronic pain, disability, and reduced quality of life. Effective management requires a comprehensive and patient care approach, addressing both physical and psychological aspect of the disease. Homeopathy, with its principle for individualization, holistic assessment, offers a complementary therapeutic strategy in the management of musculoskeletal conditions. And clinical experience and emerging research suggest that individualized homeopathic treatment may help reduce pain, improve functional mobility, and enhance overall well-being. And future well-designed clinical trials and integrative research are essential to further explore and strengthen the evidence base for homeopathy in musculoskeletal disorders. So from this, I can give one message, and it may be a take-home message. An integrative, individualized approach that combines clinical expertise, patient-centered care, and research evidence can contribute to achieve optimal functional outcome and quality of life in musculoskeletal health. And lastly, the standard treatment guideline on management of common musculoskeletal disorder in homeopathic system medicine, it is developed by CCRH. And an app also developed for this standard treatment guideline. The app we can download from Play Store, but it is not free. We have to pay to download this and to use this app. But the standard treatment guideline, it is available in CCRH website. We can use this one. And in this guideline, or in this standard treatment guideline, the guideline is given for different approaches, different types of musculoskeletal disorders like osteoarthritis, rheumatoid arthritis, lumbar spondylosis, cervical spondylosis, fibromyalgia. All these conditions, gout, all these conditions are described at different levels. In first level, second level, third level, how we can manage at healthcare facilities. So, for example, in case of first level, where the only one physician is available, that is in primary health clinic, in individual health clinics or primary health setups, only where only one physician or is available in that level. This is considered as level 1. In this level, we can diagnose where the treatment standard treatment procedures and technology and resources are limited. So in this level, we can clinically diagnose clinically without any or the X-ray or any investigations like complete hemogram and X-rays may be done or may be advised. The minimum lab investigations we can do here, and the medical history and physical examinations with a complete medical history and a physical examination we can diagnose at this level. And in this at this level, the management can be given from our commonly prescribed medicines, Brownia, Rostox, Lycopodium calcareca, Thuja causticum, sulfur, pulsatilla. From this group, we can prescribe medicines in this level. And here we can recommend the patient diet and diet management, lifestyle modifications, and there is some do's and don'ts we can advise to the patients. And in referral criteria, if there is no response to the treatment and there is an evidence of increase in severity or complications, or there is substantial impact on their quality of life, activity of the daily living, diagnostic uncertainty, and uncontrolled comorbidities, in these cases we can refer to next higher facilities, healthcare facilities. And in case of second level, where in CSCs, it's community healthcare centers, district, some small hospitals, where 10 to 20 bedded hospitals or basic facilities are routine investigations and X-rays are available. At that level, the diagnosis can be made with the presentation of the clinical presentation, with the investigational reports or lab investigations, and through or any maybe dealt with any complications also we can deal at this stage and at this level. And investigations also can be advised and done at this healthcare facilities, which can exclude the differential diagnosis, help to exclude the other conditions which may cause the MST or any pain. And at the level 3, where district level hospitals, integrated Ayush hospitals, tertiary care hospitals, Ayush hospitals attached to teaching institutions. So these are the level 3 healthcare facilities, where the same whatever is given at level 2, thus is can given at the level 3, same as level 2. At level 3 also we can give, along with the dietary management and along with the lifestyle modification advices and physiotherapy and any supportive therapy, we can help the individual to overcome the disease condition. So this was from my side. Thank you for patiently hearing, and I hope there will be some there must be some comments and inputs and their clinical experiences also to add. I will be happy to receive those. Thank you, madam.
Thank you. Thank you so much, ma'am. It is really truly a scientific seminar today. And over to Dr. Mukesh. Dr. Mukesh, sir, please.
I have some doubt. So, can you share the slide where you have given the comparison of tertiary stage and secondary stage, and that slide?
So this one.
Yes, this slide. Actually, this treatment part, which you have intervention, you have given.
Yes, sir.
I couldn't get the difference between third and fourth.
Secondary and tertiary.
Yeah.
Yes, sir. So secondary and tertiary is somewhat similar in intervention, because already the pathological changes or advanced pathology process already progressing in case of secondary stage, and it is already advanced in tertiary stage. So in case of secondary stage, the treatment therapeutic treatment means including our constitutional medicine and supportive therapy like physiotherapy, lifestyle
Hmm.
modifications, all
Hmm.
this we can give. And tertiary stage also only palliative care may be given at this stage, because there is advanced, and it is this advanced stage is not reversible in this stage. And along with that, in case of homeopathy, we can give constitutional medicine to, as well as our treatment procedure. Along with that, and the constitutional treatment can also be a palliative care for at this stage, only management of the pain.
Okay. But like in therapeutic, you mean whatever is the totality at that
Yes, sir.
time,
Yes, sir.
on that
Definitely.
totality, you will give the medicine.
Exactly, sir.
It may not be constitutional, it may be constitutional, or it will not be constitutional.
Maybe because at the acute stage, if the patient is coming, so we have to get the acute totality.
Okay, okay. But
So
here
on
you
that
have
basis,
mentioned with individualization, and here we'll give only indicated therapeutic, or here also the individualization will
so
be required.
individualization and constitutional. Uh, uh, if we see, or anti-miasmatic, if you see, there's some little differences are there, but it is selected basing upon the totality only,
Yes,
and
that will
including this.
always do.
Yes,
But here, like you have mentioned,
uh,
individualization and supporting
individualization,
therapy, and
supporting therapy.
this,
Individualization is only constitutional therapy, or because individualization includes or applicable to all stages.
right. But then it should be here also. I think this is
Here
my,
also, sir. Yes.
yeah.
Yeah, exactly, sir.
Okay,
Yes.
okay. Thank you.
Okay.
That's all.
Thank you, sir.
I was confused.
Thank you, sir.
Any other questions from the esteemed audience?
Doctor, can we have a case from you? If you have a ready case, can we discuss some case which you have cured?
Sir, actually, in progressive stages only the patients are coming. In the second stage, many patients are from secondary stage category. And here we are giving the evidences are not
You
with me
remember?
with
Do you
the court,
remember some case?
but
You
it is
remember some
only.
case? You remember some case?
Sir, one case is there. It is it's commonly medicine Rostux we are giving. It is the pain elevating. Sometimes it is elevating the pains, and pulsatilla also. And one case I remembered, Thuja has helped much in one case.
One case, pulsatilla, another case?
Rostux, sir. And sir, one of the studies going on. Sir, two of my studies are now ongoing. One study is symptoms of Rostux in comparison with the other group of medicines. And another study is with RMRC and ICMR, RMRC and ICMR Bhubaneswar. There only biological responses, the inflammatory markers we are studying in case of this osteoarthritis patients. How this patient, how the homeopathic medicines are affecting the inflammatory process, and how they action upon the inflammatory markers. So these are actually, sir, these are the initial stage studies. After the study only, we can give the evidences that these what is happening with the homeopathic medicines. And in our OPD cases,
one of the very important reasons which you have said is osteomalacia, right? You have some
osteomalacia.
experience. Yes. You have some experience.
Osteomalacia, no, sir.
Because osteomalacia is loss of muscle mass with the age.
Yes, sir. Sarcopenia condition is there. Yes.
But how do you help with homeopathy?
इस्माइल खान की को मार गया सोचिए अगर दूसरे मामलों के बच्चे की ईरान में तो नहीं बचाते
Millie, please mute others who are not asking questions.
I'm doing that, sir.
Chalo, thank you. Huh?
Well,
Thank you.
Oh,
Okay.
thank you, sir.
Okay, anyway, it was really presented in a scientific manner and in the way the research should be presented. And we liked
Thank
it
you.
a lot because you have not given it a vague this thing. You have given it scientifically and with data. Thanks a lot.